Do you go into an appointment where you don't have a doctor that's supporting you, that's cheering you on, that's saying, oh my gosh, look at your numbers are starting to come down. This is fantastic. I don't know what you're doing, but let's keep doing it. Or tell me what you're doing so that I can start to learn. Those are the things that you want to hear. And if you're not hearing that, then it might be time to consider a new one. Hey there, welcome back. This is Dawn with Dawn Laflin Wellness, and I'm a health and wellness coach that works with women that have rheumatoid arthritis that are looking to reduce inflammation in their body through dietary and lifestyle changes so that they can get back to living their best lives. Today, I want to talk a little bit about rheumatologists and what to look for. 3 things that you can look for when you are either newly diagnosed and looking for a rheumatologist, or maybe you have a rheumatologist and you don't feel like there's a great fit and might be looking for a new one. These are 3 things to consider, to think about as you start out on that quest. When you have a disease like rheumatoid arthritis, when it's a progressive disease, it can be really overwhelming, and you want to build the most supportive team around you that you can. You want to make sure that you have people that are rallying around you, that are going to support the changes that you're trying to make so that you can live your best life. Our healthcare system is fantastic for acute care. We've got amazing technology, we've got amazing medicines, we've got amazing doctors. All these pieces come together, and if somebody has an acute issue, they've broken a leg, they need emergency surgery, we can take care of that. We got the flu, no problem. We can take care of that. But when it comes to chronic care, we're lacking a little bit. I think, unfortunately, we have become so specialized in each of our industries or in each of the health areas that it's become harder to see the body as a whole. So a rheumatologist might not understand how a gut that is imbalanced and weak, or maybe has leaky gut, could be affecting the symptoms of rheumatoid arthritis. So there's different things that could be coming into play that need to be discovered, but it might not be their specialty. So you keep these things in mind as you're starting to look for a new doctor, because it's really important to understand that, obviously they came into the profession so that they could help heal and make people feel better. There's certain things like insurance that limits what they can do, how long they can spend with you, so you may feel like it was a super quick appointment, but really that's just all the time they had. So there's things to think about as you are interviewing or meeting with different rheumatologists to see who's going to be a best fit for you. But keep those things in mind, that there are some limitations if you're going through a doctor that is still using insurance, as most are. And I say that because you can get some doctors that are out of network and you pay a little bit more, but you're also getting more of their time for their specialty and their expertise. So something to consider as you look into that. But I wanted to share 3 things that you should consider as you are looking for a new rheumatologist, and why that they're important. First and foremost, you want somebody that's going to listen to you, somebody that's going to hear your concerns, listen to your questions, and not take offense to that, or not feel challenged that you're challenging their expertise, because you're not. You're just curious and wanting to know more. And you also want somebody that's not going to patronize you with answers that kind of shut things down. You want to really have a team player that you're going to be able to talk to openly about your concerns and your questions. And I share this because I have a story where I was in with my rheumatologist. I've been with him for about a year, and I had questions about, well, first and foremost, 6 months in, I was on medicine and asking, is this as good as it gets? Because he was excited that the medicine was working, and yet I felt worse than I'd ever felt before. And so I felt like there was a big disconnect. And so I asked him, and he said, yeah, this is as good as it gets. Here's some more medicine. And I thought, there's got to be a better answer than that. And that's when I really started to dig in and understand how critical it is to have dietary and lifestyle changes in place that were going to support my health where it was currently. And so that was a big eye opener for me. I made changes, came back excitedly about a year later to show him all the things that I had been working on, and the research, the things that I'd been reading, and really got shut down and shot down. And it was a big eye opener for me. I thought, are we a team here? Because I didn't feel like a team player was in the room with me. And so it was really a moment of me learning, first and foremost, how critical it is to have somebody that supports you, that listens to you, because this was a lifelong journey, and to not have that in the room, it really felt hard. And honestly, it was a turning point for me. It was a point where I decided I wanted to become a health coach and went back to school, because I thought, I'm going to walk out of here and fight. But what about the other person, an elderly person that comes in, or somebody else that doesn't know that there are other options, that there are other ways that you can feel better and not feel like you're just going down in this downward spiral. So that was a turning point for me. And that's why I just really coach heavily on the fact that you need to find somebody that supports you when you're looking for a rheumatologist. You want to find somebody that's going to support, as a number 2 item here, somebody that's going to support you in your dietary and lifestyle changes, and the idea that can really impact how you feel in your day-to-day life. A lot of doctors, rheumatologists, are old school. They are set in their ways. They will tell you, it's always good to eat better, but it's not going to change your RA. And I've been told that before, and it's mind blowing to me, because once I made the changes, within 3 weeks, I had no Aleve or Advil needs whatsoever. So clearly, dietary changes make an impact on how you feel, and yet I was being told something else. But then I say that, and I want to have a little caveat to that, is that consider the fact that the doctors had 2 weeks of medical nutrition, or of nutrition studies in their medical training. When you hear that information, it's a little easier to understand, okay, they don't know what they don't know. So if they don't know that medicine, or that food and diet really impacts how your body reacts to either the medicine you're on or to the RA symptoms, then they just don't know. So consider that, give a little grace, but keep digging, because you want to find the ones that are at least open to the idea. Somebody that has been reading research or has been hearing things. Maybe they've had other patients that have come through that have pushed really hard and got some results, and they see that now. And so they're starting to open up to the idea that dietary changes can make an impact to rheumatoid arthritis and the symptoms and the way the medicine that people are on, how their body reacts to that. So keep that in mind as you're considering that as well. There's a trend now that younger doctors coming out of their residencies and their fellowships are aware of this latest research. So a lot of times you want somebody that's super experienced, and you want to have them know all the things, but sometimes in this case, it might be something to consider where you go with somebody that is newer in the field, because they're coming in with all the latest research, and they're more open to dietary changes. They're more open to guiding you on that path of lifestyle change. They're more open to possibly working with another team player on your healthcare team, whether it's a nutritionist, a health coach, or if you're seeing a therapist, to try and work through some of the things that are causing you stress in the background that you don't realize. So there's a lot of things to consider as far as finding one that supports you in your dietary and lifestyle changes. Lastly, the third thing is you want to find somebody that's open to the new research. Diet and lifestyle can clearly make a difference. It's being shown time and time again. And so having somebody that will hear that will cheer you on, that will maybe run a test that they wouldn't normally run. So, you want to check your vitamin D, because, vitamin D is really important. It's a master hormone in your body, and you want to make sure that it's at the levels it needs to be so that it can communicate with the rest of the body and the immune function. Or maybe you want to check your B12 levels. There's all kinds of things that can be considered, and you would like to have ideally a doctor that is willing to run those tests if you're wanting to check those. So I really hope that this kind of helps give you some parameters, some things to think about as you're searching for a new rheumatologist or your first rheumatologist. They are out there. Don't be discouraged. Know that if you go to an appointment that doesn't feel like a great fit, it's okay. go and try another one. They're out there, and as the research starts to roll in, it takes 17 years for research to truly land in doctors' offices where they start preaching what the research is saying. So be patient. Be patient, give grace, but also be your own advocate and go get what you need. Don't settle, because when you settle, it only affects you. And if you go into an appointment where you don't have a doctor that's supporting you, that's cheering you on, that's saying, oh my gosh, look at your numbers are starting to come down. This is fantastic. I don't know what you're doing, but let's keep doing it. Or tell me what you're doing so that I can start to learn. Those are the things that you want to hear. And if you're not hearing that, then it might be time to consider a new one. So I hope that this has been helpful for you. And I hope that you find value. And if you do, share this with somebody that has got rheumatoid